In a museum drawer in Turkey sits a human skull that is 5,000 years old. Above its right ear is a hole, round and neat, about the size of a coin. At first, it looks like a wound, but look closer. The edges are not sharp and broken. They are smooth, rounded, almost polished, like the rim of a cup someone has held for years. Bone does that only one way. It grows back slowly, over months, after an injury heals. Which means someone cut into this person's skull while they were alive, and that person did not die on the spot. They lived long enough for their own body to close the wound. This kind of surgery has a name: trepanation, cutting or scraping a hole through the skull into the space around the brain. It sounds impossible for a time before metal tools were common, before anyone knew what a nerve was. But it happened everywhere. Ancient healers in Peru did it. So did people in France, in China, in the hills of Anatolia, the region we now call Turkey. Some skulls have one hole, some have 5. Whoever held the blade, or the sharpened stone, was aiming for one exact spot on a living head, without anesthetic, without antibiotics, and often, it turns out, without killing the patient. When the first trepanned skulls turned up in the 1800s, doctors did not believe what they were looking at. Modern surgeons of that era still lost patients to infection after simple operations in clean hospitals with proper tools. So the idea that Stone Age people cracked open skulls and the patient survived seemed absurd. Early researchers assumed the hole meant execution, or torture, or a wound from battle that killed the person outright. Nobody looked closely at the bone edges. Nobody asked whether they were sharp, meaning fresh, or smooth, meaning healed. For decades, the safest guess was the darkest one. This was a mark of death, not treatment. By the middle of the 20th century, the story changed again. Anthropologists studying skulls from Peru, then Europe, then Turkey, noticed something odd. Many patients had survived, sometimes more than once. But instead of calling it medicine, most scholars reached for magic. Maybe the hole let out evil spirits that were causing headaches, seizures, or madness. Maybe it was a ritual done by a priest, not a doctor, aimed at a demon rather than a disease. This became the popular explanation for years. Ancient trepanation as superstition that happened to work, an accident of belief rather than an act of medical skill. And that is the real puzzle at the center of that little round hole. Was it medicine or was it magic? Nobody wrote down the answer. The people of Anatolia 5,000 years ago left no notebooks, no diagrams, no patient charts. There is no letter that says why the hole was cut, no priest's account, no healer's confession. All we have is bone. So every generation has had to guess the reason from the evidence left behind, and every generation has guessed differently, which is exactly why this question has never fully closed, and still has not, even today. Then came a third way of looking at the same skull. Starting in the late 20th century, scientists stopped guessing and started measuring. Under strong light and magnification, they could tell fresh bone from bone that had spent months, even years, quietly rebuilding itself. A hole cut just before death stays sharp, almost like broken glass. A hole from a survivor rounds off, smooths down, sometimes nearly closes over. Researchers working in Turkey found skull after skull with that same soft, healed rim. This was no longer a guess about spirits or war. It was a measurement, written in bone. One place in northern Turkey, a site called Ikiztepe, turned out to hold an unusual number of these skulls, more trepanations in one spot than almost anywhere else studied from that period. Archaeologists working there found holes drilled by scraping, by cutting, and by a technique that ground the bone down in a circle until it gave way. Different methods, different hands, across generations. That tells us this was not one lucky accident. It was a known skill, taught, repeated, and passed on by people who expected, at least sometimes, that their patient would walk away afterward, headache gone, skull healed over with new bone. Modern neurosurgeons still do something close to this today. It is called a burr hole, a small circular opening drilled into the skull to relieve dangerous pressure on the brain, drain fluid, or reach an injury underneath. The tools are steel and battery-powered instead of stone and muscle, and the patient gets anesthesia and antibiotics that make survival almost certain. But the basic idea, cut a small round window into bone to save a life, is the same idea some healer in Bronze Age Turkey was already using 5,000 years before anyone had a word for microbe or infection. Some of the Turkish skulls carry more than one hole at different stages of healing on the same head. That means one person survived a trepanation, healed, and then, weeks or years later, went under the blade again. Maybe the same illness returned. Maybe a new injury needed the same fix. Whatever the reason, it tells us these were not one-time, desperate acts. Someone trusted this procedure enough to have it done twice. And whoever performed it trusted their own hands enough to try again on a patient they had already treated once before and kept alive twice over. Even now, with every bone edge measured and every healing pattern mapped, no one can say for certain what the healer believed they were doing, driving out a fever, releasing a spirit, or simply relieving pressure inside a skull that had swollen and would not stop hurting. The medicine and the magic may have been the same act, performed by the same steady hand, 5,000 years before either word ever existed. What the bone does say, plainly, in its smooth and rounded edge, is that when the cutting finally stopped, the patient did not. More forgotten history every week. Subscribe so it isn't lost twice.